Bleeding gums are not normal, they should not bleed, and healthy gums do not bleed. If you're bleeding from anywhere else in your body, you would definitely take notice or attention. So bleeding gums can be a sign of gum disease, early stage gum disease, or unhealthy gums, which can actually lead to periodontitis, which is actually bone loss around the teeth that then cause wobbly teeth and tooth loss in the end. Bleeding gums are caused by plaque and calculus around your teeth, which is a buildup of bacteria that then irritate the gums and cause them to become inflamed. Where the gums are inflamed, there will be bleeding until they are cleaned effectively, or you go and see your dentist to find out the underlying causes and find out a plan to help you improve your gum disease. So with gum disease, you may not feel it, it's not painful, you may not know that it's there, but it is a chronic inflammation and it is very bad for your teeth. It can lead to tooth loss and bad breath and certain other conditions as well. So it's very important to have a very good oral hygiene routine and go and see your dentist if you feel that you have bleeding gums or you notice blood when you're brushing your teeth and you spit out blood in the bowl. If you don't treat bleeding gums, there is a chance that your gum disease can get worse and worse and cause a further condition called periodontal disease. This then will lead to tooth loss, mobile teeth, and recession of the bone around your teeth as well. Ways that you can help yourself at home would be to have a very good oral hygiene routine. So brush your teeth twice a day for 2 minutes with the correct technique, and also clean in between your teeth as well, using a good interdental brush or a water flosser or string floss. Having a good diet would also help to reduce the bacterial load that can cause gum disease, and also sometimes using a good mouthwash such as Corsadil, which help to relieve gum disease too. If you have a good oral hygiene routine and you brush and floss your teeth with the correct techniques, then the bleeding gums should stop within 2 weeks. If your gums keep bleeding regardless of a good oral hygiene routine, we'd recommend that you go and see your dentist. In some cases, gums can bleed more easily if you have conditions such as leukemia, oral cancers, or even certain medications can make your gums bleed more easily. Pregnancy gingivitis, that while you're pregnant, or you've got hormonal changes, the gums can bleed very, very easily. You can also develop lumps and things in your gums called epulis that can really bleed and cause problems. It's not true that everyone's gums will bleed at some point. So if you've got a good oral hygiene routine and you brush and floss your teeth twice a day, bleeding gums is not normal. If you've never flossed in your entire life and you all of a sudden start flossing, you may notice that you will have some bleeding gums initially. This is because your gums are more than likely to be inflamed in those areas. So if you then start flossing or cleaning interdentally, more than likely your gums will bleed for about 2 weeks. But as they start to get healthy, you will notice that they stop bleeding and your gums will go back to being healthy again. If you find that your gums are bleeding more so when you're flossing in some areas, then certainly do not give up with the flossing. Carry on flossing those areas, brush them effectively, and go and see the dentist. Sometimes it may well be the case that you've got some calculus or tartar underneath the gums that you can't remove effectively yourself. So you will have to have professional help to remove that for your gums to be able to heal. Bleeding gums can be bad for your general health because it's a high load of bacteria inside your mouth that you are then ingesting and is going to other areas of your body too.